Good morning. You're listening to Senior Scene on your hometown station, 1430 WNAV. I'm Joshua Killian, social media producer with the Anne Arundel County Department of Aging and Disabilities. Today, my guests are Mia Rigsby and Heather Hughes. They are both older adult behavioral health PASAR specialists at the Anne Arundel County Mental Health Agency. Welcome back to Senior Scene.
Thanks for having us here today, Josh.
Yes, thank you so much.
Absolutely. And for those of us that don't already know, can you give us a brief rundown of the Anne Arundel County Mental Health Agency? What services do they provide? And while we're at it, what is a PASAR specialist?
Absolutely, Josh. So Anne Arundel County Mental Health Agency has been a part of the community for over 20 years now. There are over 100 programs that serve the residents of Anne Arundel and surrounding counties. And just to name a few, we have our Crisis Help Warm Line, where if you're feeling overwhelmed by your problems or you just cannot cope with everyday daily life, you can call the Warm Line 24 hours a day, 7 days a week. And that number just to have is 410-768-5522. There are many services designed to help you through a crisis and to get you started on the road to recovery. There is also case management services. There is also outpatient therapy services where Anne Arundel County Mental Health Agency can put you in touch with services to help you access individual, family, and group therapy. There's also supportive housing, where Anne Arundel County funds a variety of supported living programs designed to help individuals with mental health problems successfully transition toward fully independent living. Or sometimes they may need a higher level of care, such as assisted living or nursing homes. And we are here for that guidance and process as well. There's also the mobile crisis team, where our mobile crisis, they provide immediate care for people with mental health problems who are in crises. The team provides treatment and other services until long-term therapy can be arranged.
And about our role, Mia and I's role as the older adult behavioral health PASAR specialist, this program has been around for a little over 4 years. And what our role is to provide complex case coordination, resources to individuals who are older adults in the community, anywhere in the state of Maryland. And we can help with locating resources, if that is therapy, or if they need assisted living or nursing facility. We can not only help guide the individual, but we can also help guide agencies such as Department of Aging, Maryland Access Points, nursing homes, assisted livings, health departments, really anyone who is involved in the care of an older adult with complex behavioral health issues. We are there as a resource, and Mia and I also provide training to agencies and providers in the community that are interested in learning more about services and resources.
Wow, I didn't realize that the Anne Arundel County Mental Health Agency had done so much work, and it's great to know that we have older adult behavioral health PASAR specialists like you and Mia to help people in our community. For those of us that don't already know, May is Mental Health Awareness Month, and we wanted to talk a little bit about the mental health in Anne Arundel County and how the Anne Arundel County government helps promote better mental health. Mia, could you tell us a bit about the mental health in Anne Arundel County?
Absolutely. So it's very important to us. And I would also like to add, Joshua, that May is Older Americans Month as well. And at Anne Arundel County Mental Health Agency, we want to bring awareness and we want to cease the stigmas associated with mental health diagnosis in everyone, and especially in our seniors, who are one of our overlooked and most vulnerable populations. There are many adults in Anne Arundel, older adults in Anne Arundel County, who are dealing with things that can affect their mental status, such as age-related changes, their health, elder abuse, stress from finances, substance use, and maybe some type of cognitive impairment. In Anne Arundel County, we've realized that our seniors need help too. And recently, there have been laws and there have been regulations enacted to ensure that our seniors are protected and taken care of as they age. And then that is where the senior centers come in, our medical day programs, the Department of Aging, the Department of Social Services, and of course, Anne Arundel County Mental Health Agency. Each of our agencies, we always have something good and informative happening, either virtually or in person. And the weather's breaking now. So there are a lot of community activities that are planned and should be happening soon. And of course, we are here to help. And just another shameless plug, if you need assistance, please call Anne Arundel County Mental Health Agency's warm line at 410-768-5522.
Yeah, well, it certainly sounds like the mental health agency has a very wide array of things that it's working on in our county. Heather, could you take some time to tell our listeners more about the mental health of older adults specifically? And how does mental health change as we age? And what are some of the common mental health concerns for older adults? And lastly, how can our listeners work to prevent or prepare for some of these concerns?
Certainly, Josh. So as Mia said, our older adults, they're typically a very underserved and underrepresented when it comes to mental health services. It became very apparent through the program that Mia and I are a part of that after the age of 65, we don't really know what happens to our older adults. And we are trying to uncover that mystery as we speak. So as a society, I think we tend to think that as you age, depression is normal, and I'll use air quotes when I say that it may be okay to get kind of the blues or feel a little sad. Mia and I are here to tell you that is not a normal part of aging. Feeling sad, feeling depressed, having a lack of energy, or not doing things that once brought you joy, that is not a part of normal aging. And as the COVID-19 pandemic has affected all of us, anxiety is also becoming more and more common, not only as a society, but also with our older adults. They're stressed about the lack of finances, services are extremely waitlisted, or they may have trouble getting the funding to pay for those services. So that can exacerbate depression and anxiety as well. But we also notice that we're seeing some unfortunate worrying trends when it comes to our older adults. As we've been evaluating data through the COVID-19 pandemic, we have unfortunately seen an increase in the suicide rates among older adults, as well as overdose rates. More and more older adults are unfortunately accidentally overdosing and passing away, unfortunately, from those overdoses, especially with pharmaceutical medication. And the other question you asked is, how can our listeners work to prevent or prepare for some of these concerns? I think it's really important to say that we need to be more proactive as a society when it comes to discussing mental health issues and the stigma associated with mental health. People should be familiar with the signs and symptoms of depression and anxiety. If you go online, if you utilize the Department of Aging Resources and ask them, hey, could you tell me some signs and symptoms? They would be more than glad to assist. So I think we need to raise our awareness about signs and symptoms. We are definitely not asking individuals in the community to become clinicians, but at least if you know what the signs are, you can start if it's for you or someone you care about, or a neighbor, or someone in one of the senior centers that Anne Arundel County has. You can at least know where to turn for help. And as Mia stated before, you can also call the Anne Arundel County Mental Health Warm Line, and we can provide resources for the individual or someone that you care about. And individuals should also know that mental health disorders are more common than people realize. And you probably have friends or family members, neighbors, or associates that have a mental health disorder. It is more common than people realize. And we just want listeners to know here that you are not alone. If you are struggling with depression, anxiety, bipolar, any of the various mental health disorders, we know it can feel sometimes isolating, but you are truly not alone. There are resources out there for you.
Oh, wow. Yeah, I hadn't really realized or hadn't, it hadn't come to my mind just all the different kinds of mental health struggles that older adults can face and how we as a society and we as community members could get more involved. Mia, quickly, could you just tell us about what the Mental Health Agency is doing to help promote positive mental health, especially in our community's older adults?
Absolutely. As I said before, Anne Arundel County Mental Health Agency offers a plethora of programs and resources. And so one of the resources are Heather and I, who specialize in older adult resources. We specialize in older adult mental health. So one of Heather and I roles as older adult behavioral health PASAR specialists, I know it's a mouthful, is to educate the community, to empower the community. And when I say community, I'm talking about our seniors, I'm talking about the families, I'm talking about different agencies and any stakeholders who want to help, who want to be knowledgeable about the resources in our community, right? And so we also, we identify as we're out here working with the different agencies and families, we are able to identify barriers and gaps in our system. And once we identify these barriers and gaps, then we talk to people who may or may not can kind of make some changes or some improvements to help our older adults. Anne Arundel County Mental Health Agency, we also offer a lot of workshops, a lot of trainings to families and agencies, and basically anyone who's interested in topics such as healthy aging and what that looks like, behavioral health diagnosis, right? Brain health, what to do next when an older adult may no longer be completely independent in their own home. Who do you turn to? Who do you call? So we have lots of workshops and trainings that we would love to schedule with the community. We want everyone to be knowledgeable and empowered about things out here that can affect resources that can help with their mental health diagnosis. We also work closely with many agencies, to include the Mental Health Agency, the Department of Aging, local hospitals, the Department of Social Services, and other entities. We all want to work together and to collaborate to help close these gaps in services that that can help or hinder an older person's aspects of life.
Yeah, absolutely. I think that closing gaps in services and helping people is probably one of the most important things we can do as mental health and as human service professionals. Lastly, as we reach the end of today's episode, could each of you tell us one thing you'd like our listeners to take away from today's talk?
So for me, Joshua, I just want everyone to know that you are not alone. The data shows, as Heather says, that there are few of us who suffer or who are coping or who are dealing with issues that affect our mental health. Anne Arundel County and Anne Arundel County Mental Health Agency, we have many programs to help with whatever you are going through. So with whatever you are going through, if you need help, if you want assistance, just call the warm line at 410-768-5522, 24 hours a day, 7 days a week. But if you are not in Anne Arundel County, there is assistance elsewhere in Maryland, and all you have to do is dial 211 to obtain resources in your county.
And excuse me, one last thing that I would like listeners to know is that we need to talk more about mental health. This is not an issue that we should shy away from as a society. As I stated before, there are many, many people, people that you know, people you may not know, that struggle with mental health disorders, and they're able to live very fulfilling lives. They're in our community, there are neighbors, there are teachers, there are grocery store workers or doctors, and the list goes on and on. There are so many people who are living with a behavioral health diagnosis. It is way more common than people realize. And also, as Mia stated before, and as we stated throughout this interview, we understand that it can sometimes feel like you are on a lone ship all by yourself or on that island, and you may not know who to be able to turn to. You are not alone. If you are struggling, or you have a neighbor who's struggling and you just want them to get help, or you need help yourself, please reach out to our warm line or get in touch with Mia or I. We would be more than happy to assist an individual or a family who is concerned. We would rather talk to you on the phone for 2 hours if it means that every question you have, every resource you need is answered thoroughly and effectively. We want to be there for our older adults in the community, also our community partners. We want them to be aware too that we are all in this together, that if we can just talk to one another, we can really help our older adults who are living with complex behavioral health disorders.
Yeah, absolutely. Heather, Mia, thank you guys both so very much for coming on the show today.
Absolutely, Josh. Grateful to be here, and thanks for having us.
If you have any questions about today's show, or if you're interested in any of our programs, please feel free to contact the Department of Aging and Disabilities at 410-222-4257, or visit us online. We also encourage everybody to register for our Senior Activity Center programming, which can be found on our website, aacounty.org/senior-center. For full episodes of Senior Scene, please remember to follow us on Facebook, Twitter, Instagram, and Arundel Seniors. This has been Joshua Killian, social media producer with the Anne Arundel County Department of Aging and Disabilities. And remember to catch Senior Scene first, only on your hometown station, 1430 WNAV.